A 3-month-old baby stopped breathing inside a prison, and what happened next actually saved her life. तो कहानी की शुरुआत ऐसे होती है कि अमारी is a tiny ex-premature who spent the first 3 months of her life in a neonatal intensive care unit. And today she's being exposed to freezing air on a fateful trip to meet her incarcerated father. Now, according to Jamila, who is Amari's mother, says that prior to entering the prisoner visitation center, all infants must first be changed into minimal clothing in the family visitation center. Then they can be carried across the gravel lined outdoor pathway that connects the two buildings. The distance between these structures is about a 4-minute walk. And this cruel sounding policy was issued from previous attempts to smuggle weapons or drugs or both in the fluffy padded snowsuits of the innocent visiting babies. Now, after these entire formalities are done, Jamila takes her daughter and sits in a rocking chair in the family visitation center, and she's trying to warm her freezing daughter, and suddenly she realizes that Amari is limp and not breathing, and she starts screaming for help. And at that moment, a prison guard jumps over the barrier, holds the baby, and begins performing a CPR. And that one decision kept her alive long enough to get her to the hospital. A hospital pay, Dr. Tali Lando, who's also the author of this book, is ready with her specialist team because she knows that with babies this small, there's no room for mistakes. In the next step, the baby is brought into the surgery room, and just seconds after the surgery began, everything went wrong. Her heart rate dropped, her lips turned blue, the monitor started going red. In that moment, immediately Dr. Lando takes over and checks her airway using a scope and finds that the problem wasn't her heart, it was her airway. Another thing, she finds out that there's this thick scar, a fluid filled cyst is blocking her breathing completely. Now, after figuring out the problem, with just seconds to spare, Dr. Lando pushed an intubation tube past the blockage to secure the airway. Monitor stabilized, the surgery continued, and once Amira was stable, the team were able to fix the real problem. They drained out the cyst and used a laser to fix the scar. Amari survived, and she was safely transported back to the neonatal intensive care unit in excellent condition. And when Dr. Lando looked at the fragile infant who was fighting for her life, she remembered the early days of her own premature child and realized that she would rather be a doctor than a parent any day.